ಹಾಯ್, ನನ್ನ ಹೆಸರು ಚೇತನ್ ಶಿವಾನಂದ್ ನಾವಿ. ನಮ್ಮೂರು ಕಬ್ಬೂರು. ನನಗೆ 4 ವರ್ಷದಿಂದ ಬ್ಯಾಕ್ ಪೇನ್ ಇತ್ತು. ನಮ್ಮ ರಿಲೇಟಿವ್ ನಾರಾಯಣ ಹೆಲ್ತ್ ಬಗ್ಗೆ ಹೇಳಿದರು. ಇಲ್ಲಿ ಬಂದು ನವೀನ್ ತಹಸೀಲ್ದಾರ್ ಸರ್ ಭೇಟಿಯಾದೆ. ಅವರು ಸರ್ಜರಿ ಮಾಡಬೇಕಂದ್ರು. ಸರ್ಜರಿ ಆಯಿತು. 1 ವರ್ಷದಿಂದ ತುಂಬ ಪೇನ್ ಇತ್ತು. ನಂತರ ಏನೂ ಕೆಲಸ ಮಾಡೋಕ್ಕೆ ಆಗ್ತಾಯಿತ್ತು. ಇಲ್ಲಿ ಬರೋಂತೆ ಸ್ಕೋಲಿಯೋಸಿಸ್ ಆಪ್ರೇಷನ್ ಮಾಡಬೇಕಂತ ಹೇಳಿದ್ರು ಸರ್. ಅದಾದಮೇಲೆ ಒನ್ ಇಯರ್ ನಂತರ ಕೆಲಸ ಮಾಡೋಕ್ಕೆ ನಡೆಯುತ್ತೆ. ಈಗವಾಗ ಪೇನು ಕಡಿಮೆ ಇದೆ. ಇನ್ನೊಂದು ಸ್ವಲ್ಪ ದಿನ ಅದಕ್ಕೆ ವರ್ಕ್ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಬೋದು. ಥ್ಯಾಂಕ್ಸ್ ಟು ನಾರಾಯಣ ಹೆಲ್ತ್.
He's an young guy coming with a bend in his spine. If you can look here, this is called as scoliosis. Okay, so he's got this bend here, and because of this bend, there is a bulge on one side of the chest. We call it as a rib hump. And if you see that his head is not exactly centered over the rest of his body, which we call as a pelvis, and the body basically the upper part of the chest seems to be going sideways. This we call as a trunk shift. So these are the problems that these kids have, and the reason for this problem is a bend in the spine, which is called as a scoliosis. Generally, when they are young and there is a lot of growth left, because these deformities can progress, and because of which they will have problems with their breathing, and eventually their quality of life starts to get deteriorated. Of course, the cosmetic problem is always there, that it's not good to look at. So these are the patients where we need to go in and do a scoliosis correction. We correct the deformity in the back and make it straight by doing surgery. And here is the same patient here, Chethan. So this is after his surgery. So basically we have, this is a cut that we use, and then we have used some screw and rod here to basically fix the spine, and then with the rod we have corrected this thing. Now if you compare what he had before to now, the sideways bend which he had compared to the pelvis, and this has come back to its place, and the rib hump is considerably so both the sides now are looking equal, not that this is bigger than this. So this is all equal. His head seems to be centered on his pelvis, and and he stays here. I mean, he is now 3 months post his surgery. I have been following him up, like initially I saw him at 6 weeks. Now it's a 3-month mark. He has come to see me again. So so far he's going very good. He had a small another problem downstairs. He had something called a spondylolisthesis, which we have not operated, because I believe that his spine correction will hold, and that wouldn't need any kind of surgery. And otherwise his life is good. I mean, he's been walking around fine. He's doing very well pain wise and otherwise also. So any kid who is coming with a bend in his spine, sideways or forwards, any kind of deformity in the spine, it's mandatory that they consult a spinal specialist and analyze what kind of a problem that kid has. If these deformities are detected at an earlier stage, these can be managed by simple measures like giving a belt, a brace, and following them up regularly. And one more thing, if you think that your child has got a bend in the spine, one simple test that you can always do to check whether there is a deformity or not, it's called the Adams forward bending test. You can ask the child to bend forwards this much, maybe around 30 to 40 degrees, and then you will start seeing a little hump in the back. That's one of the simple tests that can be done at schools, at home, if you feel that your child has a bend in the back. I would urge all of you to consult a spinal specialist and seek an expert opinion, so that these can be managed effectively. And in today's era, we can give a good result to these kids, and their morale tends to get boosted with all of these measures.